Jim, everyone. Welcome to another stream of Pump Science Experiments. Today, we're going to be going over two different worm experiments that were initiated a few weeks back, and we now have data for. And so the first one is astragaloside, which I think this was another experiment that they launched. They'd already had one that's completed, but they're launching one that will be streaming shortly. And then the next one is ICAR, which is basically the submission of Ali G, who should be here shortly. But we've got Dr. Zamora here, aka Crypto RuMD. What up? How are you?
I'm really good, thank you. Really good. Nice outfit. I think you're looking like Steve Jobs. So.
Well, you're looking like a doctor. So it's probably how you should be looking.
Sometimes.
Yeah. What patients are we treating today? You don't have to say their names, but like what do people come with to you with today?
Lupus patients. Today are lupus patients. Yes.
Gotcha.
Yes. Investigational treatments, actually. Research protocols with lupus.
Mm-hmm. What are you testing? Like intervention?
It's two drug, like a two cephalic antibody that is actually blocking BLyS and TACI. So it's like a new antibody that is called ianalumab for the treatment of lupus. And the other one is, sorry?
I said amazing. What does it target?
It's BLyS and TACI.
Okay.
It's like the communication. It's a co-stimulator inhibitor. Mm-hmm.
Cool. Very, very cool.
It's really cool. And the other one, it's like another drug that it's like intended to kill cells that are actually in the nodes, like in the third lymph nodes that are like actually like being developed in lupus with a lot of time, like a very chronic illness. And this is like targeted to protein that actually makes the cells live more. So it's like actually we're not like in longevity for lupus cells.
Super interesting. Yes, our lives are so different.
Yes.
We're sitting here running worm experiments, and you're treating human beings for actual diseases.
Yes. Also, I'm making races with flies. So flies, sorry.
Amazing. What's up, Christian? How are you?
Hey, good afternoon, good morning.
Good afternoon to you. Good morning to us.
Yes.
How the heck are you?
Very good. Yourself?
All's good.
Good holidays.
Great holidays. I don't celebrate Christmas, but we get the day off, so we were chilling hard. And yeah, end of year's coming up. Do you celebrate Christmas?
Yes.
Amazing. Amazing.
But it's a good time to see like the snow and all the trees, and it's good. Even that you are not into Christmas, you can like feel the emotion of the people.
Totally. It depends where you are. Like, I'm in Chicago, so we have plenty of snow here, but I feel like you're not getting much snow in Mexico.
Fred, I was in Chicago like 2 months ago, and you weren't in your Chicago. You like traveled to New York. I don't know. I can't remember.
Got it. Yeah, no, I travel quite a bit, especially during the winter because it's so freaking cold. Like I want to get out. It's really
cool. I love Chicago. It's like incredible. I mean, all the actual culture. It's like born in Chicago.
Yeah, totally. They say that house music, they debate whether it was started in like Detroit or Chicago, but like one of the two. But yeah, good food, sports.
Yeah, incredible food. I love the cheese of the pizzas and the burgers.
Yeah, it is good. Anyway, Christian, how's the day job? How's cooking up drugs for pharma?
Right now I'm on vacation, but
amazing.
Other than that, it's going well. Yeah.
Amazing. Anyway, I haven't caught up with the fly studies that are ongoing, but what's kind of your conclusion from what you've seen?
I think for the fly studies, it looked pretty good, right?
Yeah. I mean, definitely on the
45, I
racing.
think. Say again?
For the racing, it's looking really good. Like the racing
Yeah,
data, really strong.
exactly. But
Um,
then I think the warm data, right? We increased the dose from or the concentration from, I think, 5 micromolar to 50. No, was that?
we did. So 10x. I don't know if it seems to be working as well.
Oh,
Let me see.
so actually the life extension decreased, or what?
I think so. I
Hmm.
think so.
Something
Let's,
similar happened with Kurtz when I raised the dose. Also, we got like more
mhm.
toxicity. Mhm.
Hmm.
Yeah, the therapeutic window's tight. It's so hard to pick the best dose initially,
Yeah.
and to know whether to go up or down. Um, but anyway, I've been listening to some podcasts on astragalicide. Um, Atia talks about it a bit. Specifically, like, I mean, I think what's interesting is like for longevity, people are saying it's the effect that it has on telomere length.
Exactly.
That is what gives it its longevity promoting effect. But it's hard to believe that that's why it was so prevalent in Chinese medicine.
Yeah. I think
You know.
the reputation it has from Chinese medicine comes more from anti-inflammatory effect, kind of, effects on several pathways, as I laid out in that
Hmm.
YouTube video that I created. It has anti-inflammatory, antioxidative effects, antifibrotic effects, but that's because it acts on several pathways, um, as many natural products do.
Hmm.
And I think for longevity, there's only a small number of publications where they looked at telomere length, which was actually shown in some cells that telomere length was increased, and then telomerase activity was increased. But I think it's more kind of acting on several pathways and has general, effects on health and well-being, at least in animal models and on cells. But it may not be the perfect longevity drug. Let's put it that way. Yeah.
I guess like if it acts on the immune system, and that's kind of where a lot of its therapeutic benefit comes from for humans. I don't know if
Exactly.
that's going to show in worms, you
Yeah.
know.
That's
So maybe that's why you're not getting like a clear benefit here in the worms, but we are running mouse studies, which is cool, and those are about to initiate.
yeah.
So excited about that, because hopefully it can manifest and be shown there, like what the effects are.
Yeah.
Um, so yeah, I wouldn't take this too much to heart if most of the effect is a result of its immune effect, and you're working in an animal model with no immune system.
Yeah.
Maybe we should have Dr. Zamora give it to some of his lupus patients and see what happens.
Yeah.
Yeah,
Exactly.
yeah.
Yeah, I think it would be great. We also, we're trying to test also chloroquine. That I mean, I'm actually sure that it's not going to help worms because they don't have like a very strong or any immunological like defense system. But maybe in mouse, it's going to help like a lot. So I
Amazing.
actually saw that there's another launch of metformin. So it's incredible.
Yeah, yeah. What's up, Ali G? How are you?
Hey, how are you? Sorry. We had an
Um,
accident just as the stream started. My wife cut her finger. And I had to rush and make sure it's all
is she
okay,
okay?
She's okay. I might have to check in a bit, but then she said just
Okay.
join in at least so that, yeah.
I'm so sorry
Did
to
you
hear
guys
that.
begin with, yeah, no, it happens. It's a small accident. I mean, yeah. I just wanted to make
Okay.
sure the bleeding stops and it's,
Please.
disinfected, everything. Yeah. So, yeah, I mean, would you be okay if I join like in 5 more minutes, 5 to
Of
10?
course. Do
Okay.
what you
I
need to
thought I'd
do.
show up so you
Stop the
know what's,
bleeding.
yeah, exactly. See you
See you
later.
in a second.
Save your wife.
Oh my God. Yeah, please. She needs you. Awesome.
Did you already
But
go
yes.
over the warm data for the other compound?
No, it's about to, it's after yours basically. So your stream's first, and then we're gonna do his as well. But yeah, his is in flies as well.
Okay.
So we can look over that data also. But I'm really excited for the mouse studies. Some of them have already started, like the performance ones. But what we're working on, and maybe what we can tease here, is our objective is to gamify all of the experiments that are coming out from the mice. And so we've got like mouse racing, and this is, you know, kind of like what the experience is like, but basically like each, you know, piece of mouse data is basically like, we run an assay called open field. I can actually pull up the raw data and show you. But basically what we do is we drop the mouse into kind of it's called an open field. It's basically a box. Oh no, I got to do the whole thing. One sec. We drop the mouse into like an open box, and you let them run around, and you basically measure how much they explore the box that they're in. And it's a measure of like curiosity, you know, youthfulness, ability, you know, mobility and things like that. And it's a good surrogate for like how, you know, young is the mouse, so to speak. And so this is kind of what we're trying to see with the drugs, is do they kind of like keep the mouse, you know, exploratory, so to speak, and like keep moving around the box. So if this will play. So here we go. So like each mouse is dropped into a different square. They kind of explore around. The raw data itself, like the videos, is like not really that interesting. You know, it'll be interesting to correlate what you're seeing here with the data, but we wanted to make it way more fun to watch. We didn't think this was particularly fun. And so we created these races, and that's what these are. And so it's basically transforming the speed that the mice are moving to this speed data that's kind of shown here in a race format. And so we're integrating this with like trading and whatnot. So you can, you know, basically trade each of the different tokens as the races are going on. And there's a leaderboard and whatnot. So this is what we're building right now for the open field tests. Now, our objective is to do this with every single experiment type. And so, you know, basically like, we're going to do this for grip strength as well. So another test that we're doing on the mice is testing how strong they are. So yeah, basically how much force can they apply? It's another measure of like, you know, how good is the longevity of the mouse. And so we're transforming this data into like a mouse lifting competition.
That's cool.
Yeah. So anyway, gotta improve this a bit, but it's pretty fun. It's just like a way more fun way to interact with the data than like looking at a table or, you know, just looking at the raw videos of the mice. So anyway, that's what we're doing as we speak with.
It's like the Pomps Olympics. No?
Exactly. It's like the mouse doping Olympics, you know?
Yeah.
That's basically what it is. So yeah, should be a lot of fun.
But so far it's all like simulation. There's no real data behind it yet.
It's all real data.
Oh, it's all real data.
Released it. It's all real data. Yes. Cool. Yeah. So we've done some performance testing on some of the initial compounds to help them like identify the right dose. And so we have some real data there. And so, yeah, once we have kind of like the user interface set, we'll launch the data for that experiment, so to speak. So yeah, that's kind of the goal, is like to have all these different kind of events, like Olympic events that all the mice are competing on. And so in the interim, like before the mice die, and like that becomes the game of like, you know, make the mice live longer, you have these intermediate games that keep people engaged. and are fun to watch. And like also just to know, like, you know, how does astragaloside actually improve longevity? Does it improve, you know, something, you know, with regards to mobility? We're also doing like cognition testing. You know, does it improve their cognition? Like, you know, strength. Like there's a bunch of different ways that compounds can contribute to the health. And we're kind of measuring that every way and like turning each kind of assay into its own competition, so to speak.
Yeah, cool.
Yeah. So that's ongoing.
And Benji, if I may ask, I mean, so down the road, let's say 1-2 years from now, if you have, you know, accumulated all the data for some of the compounds, how are you gonna, you know, build a commercial case for that? For the compounds, for instance, that are not approved as, I don't know, for human use or as supplements or whatever, right? What's the strategy there?
Yeah, the strategy is to do GRAS testing, generally regarded as safe, which allows you to get it approved for human consumption. So if you're trying to get a drug approved, then you need, for a disease, then you need to run FDA trials.
Exactly.
Right? If you're not trying to get it approved for a disease and rather for human performance or longevity, then all you need to demonstrate is that it's generally regarded as safe. You can get it approved as a dietary or food ingredient.
Yeah.
Right. And so the objective is to take it more in that direction. And those studies are much less expensive. And yeah, much practicable than, you know, clinical trials. So I think this data is final. So that's the kind of commercial strategy, is like, if we find something that's longevity enhancing, performance enhancing, take it through GRAS testing rather than FDA disease-based clinical trials, and try and get, you know, kind of like a generally regarded as safe designation versus getting a drug designation. And so, yeah, definitely a faster path to market that way.
And how do you encourage then the, you know, the community to hold their tokens, or, you know, because we saw that with your great post, right? There was a short kind of increase and then a drop, like a pump and dump, unfortunately. You know, how any ideas how to deal with that?
Yeah. So, I mean, if you think about it, like, why do people hold shares in companies? Because there's economic value that's tied to the underlying asset.
Yeah.
And so, you know, as much as we can, and within as much bounds as we, you know, are able to operate, our attempt is, or our goal is to do the same thing for the tokens. So to have real economic value go to the tokens, and that be the incentive to hold them. You know, like if we can sell a novel longevity therapeutic that wasn't otherwise approved before, then, you know, that should be, you know, valuable in the market, generate sales. And if we can have some of the value of those sales go back to the token holders, then that should be an incentive to hold the token.
Yeah.
It won't for the meme traders who are pumping and dumping, right? But to proper, you know, investors who are much more strategic and thoughtful, and patient, you know, like they should value these, you know, the tokens more highly that have, you know, a viable consumer path, basically. What do you think about that?
Yeah, I was thinking that maybe if any of these products comes to market, also you can use the fees of the any like bottle that you sell to burn tokens. So also pay revenue for the people that's actually holding your tokens. So it's I don't know, maybe the strategy is going to be different for anyone, but it's difficult because also we have like testing a lot of compounds. But I hope that any compound that is actually running just hits the market someday.
Totally. So yeah, I think like, yeah, I mean, this has been the objective, is like come up with a consumer product from the research that's done here, and then have sales buy back and burn the tokens. Like that is the objective. So anyway, it will. I think it will of course take time. I think it will take less time for compounds like astragaloside that are already approved, as a supplement, and you can already sell. And so there, the data just becomes like a marketing data, not necessarily, data that's presented to a regulatory body, but rather data that's presented to the consumer to say, hey, this works. It's
so that in that sense, it would be awesome if you at some point have a kind of a store built into pump.science, with all the supplements where you can directly purchase from, the website, and you have all the underlying data coming from the studies you've run in the past, right?
So potentially, yes. I think that, at least in the US, 80% of supplement sales, guess where they come from?
Amazon.
Yeah. Yes. So I don't know, like maybe you're right, and we need to build our own kind of like e-commerce platform that sells these. But I do also think that it could just be effective marketing data that's sold in another marketplace to maximize reach. So I think it'll be an and, not an or. Like you have both. But yeah, it is still to be determined. But yeah, no, I think we will build exactly what you're talking about, like an e-commerce platform where people can buy these once we have branded versions of them and our own kind of products. But yeah, I'm really excited about running human studies as well, so that people can basically buy the product and participate in the study quite seamlessly and receive tokens as rewards for doing so. I think that's kind of like that's going to be where the tokens are super valuable, is to be able to get people to participate in the studies. Anyway, we're on ICAR. This first dose that we're looking at is the highest dose that was tested. So we got 3 doses tested for ICAR. Ali can tell you all about ICAR. But we tested 3 doses. So, this first one doesn't seem to be working the best, but we could have overdosed the worms.
Yeah, I think we were, yeah, absolutely. So we were a bit like, the thing is, with most of these experiments, like most projects, people take something that's been tested, at least academically, and try to replicate and then to add to it. ACAR has never been tested for lifespan per se. It has been tested for very extreme applications, like, for instance, tolerance to severe hypoxia, to anoxia, and so on. So with that, it was tested at very high concentrations. And it's like, looked at the studies, showed what shows AMPK activation, and went for that. Testing also like a series of concentrations. From what this is also news to me. So from what I'm seeing here is that, okay, worms didn't take it as nicely as flies seems to be. So yeah we'll have to see. We had discussed a bit, and the dose seems to be very stressful for the worms, that they're like having this type of this phenotype of laying a lot of like infertile eggs, just like this response to maybe a fight or flight, or like a last chance thing or so on. So we've got some investigation to do here, but I'm happy about it anyway. This is a new data point in the literature that doesn't exist, so several data points. And with flies, we seem to be doing better, so we see.
Amazing. Which is the fly experiment that you're most excited about?
For racing, that be experiment 2, if I'm not mistaken. We can look at, so if you go to right, so for survival hasn't made a difference, but if you look for racing here, oh no, not this one. Come on, let me by the way, is the order always fixed? I sometimes felt like that you once pick an experiment and it's not like the experiments all exist, but not in the same order all the time. But maybe it's just my brain.
No, I think you might be right. I don't think they're
So
fixed.
every
I think like
time-
your
yes.
your experiment one and my experiment
Yes.
one are not necessarily the same.
Exactly. So look at for me, it's experiment 4 for now, because it has been something else before. So if you go to
What's the
experiment 4,
record for you?
the record,
Like
21 for racing.
Okay.
So winning 20 races, yes. So I'm really excited about this, not only from the perspective of the number of races won. Yeah, so if you click now play, you will see the update, which is race number 20. But it's also
Amazing.
by how much it's like enhancing speed at 28% for almost all days. For the other conditions, mostly they're winning, but not by much. Here it seems to be very meaningful, like the enhancement.
Totally.
And I'm excited for lifespan. So this experiment, I think, should be still neutral for lifespan. There is one condition that seems to improve lifespan by, it's still marginal, but takes time to see. Let me tell you which record we've got.
They might be different for both of us.
Yeah, exactly.
But it
for
could
me,
be it could be
it's
this one.
experiment 3. Show
Okay,
me.
Same.
Yes, so we've got this, yeah. So if we look at the comparison, there seems to be something there. And we've got 4 different conditions here. Not only the dose is different, but the dosing regimen and so on. So we're exploring here quite a bit because, I mean, a lot of interventions affect AMPK, but then they affect other things as well. Here we're trying to isolate this effect. The way I see it is that probably this could become something where you use it to boost other interventions. Like you do exercise and you know when to do it, both for enhancing your performance and then also enhancing the efficacy and the, like basically increasing your gains. Same would be with fasting, same would be with other interventions like, say, supplements or pharmaceuticals and so on. Yeah, so there's where we are now. Quite excited about this racing thing. It could also be due to this calorie restriction mimetic thing, because then the flies are flying more so that they can find food, because if it puts their brain into this energy deprived state, then by nature you would move a lot. Actually, even in humans, like if you're doing fasting, you see that if you like with a prolonged fast, you start then you become more aware of your surroundings, and then kind of your movement becomes lighter. And much of this has to do with the brain looking for food. Basically, it's very primal.
Totally. I wonder if it's too much for the worms.
Yes,
and so that's why they're just ejecting their eggs, because they're like, I'm in a calorically deprived state. I don't know if I'm going to survive, but maybe my eggs will.
Yes, probably that, and probably it's too much, as you say, for the worms. We can't do dosing regimens. It's a bit rudimentary in the worms, that we just like putting them on a medium where you've got like the initial treatment and that's it. With flies, we can play a bit more. So I'm grateful we have this, because say maybe such an intervention would have been dismissed if it were only worm results now, that people would be like, so at least we've got something here to say, okay, hang on, in more evolved organisms, we can get something here. So maybe it's worth testing in mice.
Totally. So yeah, like it does look like, I think this is the highest dose we tested. It did decrease life extension, but that could be just the way the worms respond to AMPK activation, which is they basically sacrifice themselves for their eggs.
Yes.
You know, so that basically maybe their eggs could survive times where there's greater food, or where they think there's greater food, because AMPK is not being, hit super hard by a drug.
Yeah, probably so. Probably they still behave like they're more. I'm wondering, I mean, like on the evolutionary scale, where you start getting the structures and the circuits that can basically mediate this benefit, So it's like, we know in humans, for instance, you're way less likely to die of starvation than of overeating. It's not the same for a worm, probably. So like when you look at so it's interesting to see for these beneficial interventions where it starts and where like it ends the benefit. in yeast, for instance, sometimes you look at doubling times instead of looking at like just really how long a yeast cell survives. So maybe that's one thing. Yeah. So like so many different ways to approach this. I'm grateful we have this one intermediary step between worms and mammals. So where we've got something so let's see how the fly. I'm bullish on that. That the fly experiments will tell us something that we wanna then proceed into mice to test both performance-wise and maybe lifespan.
Totally. I am very interested to see like whether the mice's response to it. Like, do they have similar responses to us? Like, we're doing these open field tests. Where we basically put mice in the middle of a field and here we go. Here's a video. There we go. Yeah, so this is one of the most predictive assays, apparently, for mouse longevity. And it's basically like you put the mouse into a field and they just walk around as much as they want. There's no stimulus here. But you have to think, like, if you activate AMPK and all of a sudden these mice think that they're being starved, are they running around more? Because they think that they're in a calorically deprived state that's activating the parts of their brain that are saying, go look for food. And it'll be very interesting to see if they're anxiously moving around looking for food also.
Yeah, that would be very interesting. A maze would be interesting as well. Like, do they have, like,
you'll be very happy to hear we're also doing Y maze.
Right. Oh, you are? Okay, yeah, amazing.
We are.
Yeah, super. So we just have, this has to make it to mice, basically, and we hope that enough people are as excited as us that it crosses this line.
Totally. Do you know how this assay works? The Y maze assay? I just learned. So basically what you want to see is exploratory behavior. You want to see it moving around, not just sitting in one spot. And number two is you never want it going back to the arm that it just came down.
Right. Yes, that means, okay, makes sense. Yeah.
So you want to see it basically going from one to the other, remembering that it had just been down this path, and so now it should go here. So that's a correct move.
Interesting.
Right?
Okay. Yeah.
So now when it comes back, it should be realized, oh, I was just here, so I should go there. So that's like a -1 point. Okay. Because it doesn't remember that it was just there, and it should have gone to the other one.
Right. Oh, amazing. Yeah. I mean, I wonder. Yeah. So basically, maybe this type of hormetic stress puts the brain in the place where it's faster, it's just reacting faster to stimuli. But then the second question would be, is it? And that's also with the flies. I'm just thinking, okay, so these flies that are flying faster, they're not doing better. I mean, most flies are actually on average flying faster, but the ones that are clearly outperforming, the ones that like are 21. So with these, I'm just thinking, okay, they still haven't demonstrated a lifespan advantage. So I'm just like hoping they're not overstimulated, so at the expense of their lifespan. That could be. We have to see. So we might actually end up in a place where there's a good dose for, okay, if you want them to be super fast today, you give them this. If you want them to live longer, you give less. And then we explore these two pathways of basically performance enhancement on the one hand, and then longevity on the other. And then that can maybe translate into an acute and like a dose which you have like for special performance, and then a maintenance where like it's a good background level of AMPK activation, which many people, by the way, get by metformin today, or like anyone who's doing proper, say, intermittent fasting, calorie restriction. All this is like in part increasing your baseline of AMPK activation. So we'll have a chemical like tool, basically a molecule that can do this.
Have you experimented with intermittent fasting or ketosis?
Absolutely, yeah. A lot with intermittent fasting, a little bit less with ketosis. I've also experimented with exogenous ketones. Exogenous ketones is amazing. I mean, I like the brain state with them,
Right?
but I mean, it's crazy, huh? I mean,
It's insane.
it's freaking really boosted. Yeah, I'll kid you not. But one thing, twice I tried a proper larger dose, and it's this basically ketone alcohol. I mean, I forgot exact name. Ketol. I mean, that people call it ketol, like as So I tried twice, and both cases, a couple of days later, I'd come down with a cold. Not something very bad, but not a keto flu either. It's like so I'm just thinking, I'm not sure how it affects immunity. Long story short, yeah.
Interesting. Huh. I can't explain that. Not off the top of my head. I mean, I'm very familiar with keto flu.
Yes,
but keto flu, yeah, keto flu is not immune. It's just your body switching energy sources and, having a tough time with that.
Yes, but it could be it could have some inflammatory aspects to it or new regulatory aspects, and then if it actually has that, and if there caveat, I've got little kids at home, so I'm under constant, and they were in both cases going to the kindergarten, so I'm under constant challenge. You can consider me like for epidemiological studies or sort of testing vaccines or sort. Yeah, I mean, so you're under this constant barrage, and twice with the ketones, I would come down with a cold. So like I took note of that. I haven't tried it again. Maybe I should have actually during this phase of like having a break, because like if the kids aren't going to kindergarten, then you have less exposure. So we're looking here also at...
This is the second dose that was tested.
Right.
I think this is the middle dose, but I'm unsure. It might have been the lower dose.
Are we looking in worms?
Yes, this is worms.
Oh, so do we have one winner in worms? It seems.
This is the lowest dose that was tested.
Oh, goodness me. Okay, then we've got... I didn't even see that. I thought all three conditions failed.
No,
that's great. Then it's pretty straightforward, man. I mean, it's pretty straightforward. We have overdosed the worms, but at least,
This was the biggest dose. Clear overdose.
Yeah.
And then...
Yeah, they can't tolerate it.
Yeah, this number sense. 2, this was the lowest dose.
Yeah. I mean... See?
Looking good.
So, yeah, it's looking quite good. Yeah, I wonder... Yeah. So, maybe even a lower dose would be of further advantage. I mean, here's the thing. Most people have a dose to anchor to because because it's been tested. This thing has not been tested. That is why I'm really excited about it. I was like, if I'm going to dabble with this, I want new data points. Like, I mean, I know, not necessarily best for marketing, but cool for fueling.
No, it's awesome.
Yeah. Do you recall the concentrations for those 3 experiments?
Yeah, I do. I don't know if we want to share them yet before we publish, but we do have the doses. So the first one that was tested, I think, is 40x this dose.
Okay.
So, between 1 and 2 orders of magnitude higher than this dose.
We've talked, exactly. So we're not even talking about tweaking. We're really talking about there's this whole range. Good luck.
Exactly.
Yeah.
Crazy that it hasn't been published.
But man, I mean, we should publish this. Like, this is publishable like this.
Let's do it.
Yeah.
Let's do it.
Let's do that. I mean, once
we have the fly data.
It's already publishable. I mean, from what I see, because this has never been reported before. At least not I could find. But I mean, of course, with flies and let's explore also what, I mean, I'm no expert in fly or worm biology. So what I'd like to look at is, why, but it's probably the dosing modality also that makes a huge difference. like taking this one constant dose as opposed to being dynamic, and we're exploring different dosing regimens also in flies. Yeah, we've got a publication here already. Have you guys published before?
We have done a preprint.
Amazing.
We haven't.
Yeah,
Yeah.
Yeah, I know. Yeah, you haven't like submitted to a journal.
Yeah, exactly. Like,
yeah, but
I've submitted multiple. I mean, I'm on multiple papers on journals, and I know how terrible that process is of peer review.
No,
it's so slow and annoying.
Now let's do a preprint. Let's do a preprint, and we write it in a way where journals would beg us to submit it there.
Sounds good to me.
Right.
They'll be paying us for the publication. How it should be.
Yes, absolutely. Yeah. With advertisement rights.
You're welcome.
Right.
Works for me. No, I think it's a really exciting data point. The fact that, we're able to get the full like dynamic range from, killing to, potentially life extending is awesome.
Absolutely.
So yeah, it seems like this is about the number. Super exciting.
We can maybe, let's see if people are as excited. We should communicate it more and so on now, like get people excited about it. So if we got some extra funding on the side, we can do more exploratory in worms. So like, yeah.
Totally. But yeah, it looks like it moved from like median lifespan was from like 53 and a half days to 58 days.
Because we've got this, we couldn't have increments. We just have like orders of magnitude. There can be many doses in between that are advantageous. I'd be more. This made me quite more optimistic, seeing that at least one concentration worked in worms, because it means that the thinking is right.
Yes.
If none of these work, then we'd say, okay, maybe worms don't like it. But now we know, okay, it's just a concentration problem.
It's just a concentration thing.
But
also, like, I think we should laser focus on getting some mouse data versus trying more doses on the worms.
No, absolutely. I was just like you want to be king.
Fair enough. Fair enough. I respect it.
Yeah.
We're not playing for second place here.
Yeah, right.
Fair enough. Oh my god.
Man, love it.
I think it's almost
kudos to you how you've actually built this. This is research on steroids, honestly. Like, it's much faster than how things would advance if you were now doing, I don't know, one was doing their master thesis, PhD, exploring this. And there is this thing to, decentralizing ideas and centralizing that actually, like execution, automating it. Amazing.
That's the idea. All right. I'm just waiting for the final result here, but seems to be completed for the most part. Yeah, I think there's maybe a few frames.
So it's basically, I haven't actually yet familiarized myself with how, so it's like, it's really live stream. Like someone now watching it, it will like come bit by bit, right?
Exactly.
Yeah.
But yeah, I think the final number is around 10% life extension.
Not bad.
Not bad.
I really like it.
Yeah.
Ooh,
yeah, there's still a few more frames.
14%.
This is mean life extension.
Right.
And what we have, like the final score we have is median.
Yes.
So
makes sense.
We picked mean so that you can have a continuous readout. But median is like our final score, so to speak.
Absolutely. You have median. Do you have the 90th percentile?
We can calculate it. We probably should.
Yeah, I'm just thinking that's what the ITP does, for instance. They really focus a lot on this 90.
14%.
Amazing.
Final
Love
number.
it. And for the others? The others did cut their life short, right? I
Yeah.
mean,
Yeah.
no,
So I don't know if this is in days, but it's approximately time. 104.
This is
I'm
probably
looking for 90%, by the way.
Uh-huh.
104 to
these frames are.
yeah, these are
How many
frames,
frames per
not
day?
days.
Not days, yeah. Wonder
But
how
it's
many frames per day.
approximately time. It's approximately time.
Yeah.
So 113 to 104.
Yeah, great.
113 minus 104 divided by 104. So it's about a 9% maximum lifespan extension.
Okay, got it. Not bad.
Not bad. Congratulations.
So,
yeah, now I think this is the middle dose that was tested.
right.
So
Interesting.
we've got
Okay.
yeah, so we tested 3 doses. The first one that didn't have a good result was the max dose.
Yeah.
This dose is about half of that.
The one that what? Oh, interesting. Okay. So and then the lowest dose?
The lowest dose that we just got the result on was 1/40th of the original dose.
Is the one that has the max life extension that we have so far, or the only one that extended lifespan? Yeah.
Exactly.
The other one did, but like by nothing. Okay, got it.
Yep.
Actually, both of them converged eventually on. But this is just giving you the mean for a data point, right? Because it's still running.
Exactly. Yeah. So this means like probably one fly or one worm has died. Yeah, 2 worms have died. So that's why we use the mean, not because it's the final result, but because it allows you to continuously have a score.
Yes.
Yeah.
Makes sense. Yeah, you want median and maybe 90th to approximate average and certain things can help you live longer if you survive everything before. Yes, so like starting. Yeah.
Amazing. So should we get started on the paper this week?
Absolutely, man. Let's do it. Let's do it.
Great.
How long? I mean, for flies, it's gonna be like 3 more weeks, maybe, till flies are all dead, or maybe not. Maybe they live longer.
Oh yeah, true.
Yeah, but we can start with the mouse data, maybe.
Totally.
So Benji, for astragaloside 4 again, overall there was for the higher dose no life extension at all, but rather shortening, or
let's see. Yes, for the highest dose, we had -7%, and the lower dose was no change.
Okay.
But look, I mean, like, if this was used in Chinese medicine for its immune response, like its immune effect, I don't think it's going to show in worms.
Yeah.
I think it's that simple. So I wouldn't be discouraged by it at all. I just think it's the wrong model organism to test the mechanism. So that's on us.
How are the flies doing?
How are the flies doing? Responding well from a health perspective.
Really well. Mm-hmm.
Yeah, definitely. I'm not sure. I think the survival data is quite neutral.
Interesting. Okay, it has some boost at the beginning.
Some boost at the beginning.
It drops. Yeah.
Yeah, it drops.
And then it's it's like it's probably what you said, Benji. It's like probably if it's the immune system, these complex effects cannot be replicated.
Do flies have immune systems?
I was thinking exactly the same. Like, what is I mean, everything has an immune system, but like, do they have differentiated cells? I don't know.
I think that flies don't have like an adaptive immune system, but they have like toll-like receptors and something like that. So maybe they can regulate autoimmunity also, life extension. So we have like a lot of models in Drosophila about the immunological process, but not as we have. I think all of the compounds that we actually need to test need to go to mice. So people need to help us. So
Okay,
please, if
you know
you're-
what's interesting? I didn't know that. I did not know they didn't have adaptive immune systems. They just had innate immune systems. Because what's interesting is like there was this paper that got published, but like flies basically die when they see each other dead. And that's
Really?
probably because they don't have an adaptive immune response. Like, you know, a novel bug will kill one and then it'll
Right.
just
Yeah. Okay,
spread the
got it.
rest. Yeah. Because they don't have adaptive immune systems.
Makes
So that's
sense.
really interesting. But like one thing I've been observing in the data that we're generating is like as soon as a tube of flies starts dying, they all just get wiped out.
Uh-huh.
Yeah.
Okay. So they correlate more with the tube than with the. Okay. Interesting.
Exactly. Which is super interesting.
Yeah.
I
we
did
have
not
now
know
the
that.
key. We need to test compounds that are actually like helping innate immune system for flies.
Mhm. Yeah, toll-like receptor activators and stuff like that.
Yeah. Also,
DMSO. Isn't DMSO just like an activator? Yeah. Anyway.
Yep. So chloroquine.
Oh, chloroquine.
Metformin
Yeah.
also. Yeah, chloroquine,
Makes
metformin.
sense.
I think also doxycycline and all these drugs are actually helping like the innate immune system.
Amazing. Yeah, I think we just initiated doxycycline on the flies. I need to check, but I think we did. Yeah, we did. Yeah, those are on the way as well. All right, where were we? Back to worms. Okay, this is the middle dose, 37. Let me just confirm that. Yes, so 37 is the middle dose. This was half the max dose tested. So really interesting. The effect seems to be right in between. Pretty
Wow.
interesting.
Very interesting. Yeah. Yeah, exploring this area between the lowest and the middle.
Yeah. Anyway, yeah, we should probably be testing at least 3 doses for all the worm experiments. But yeah, I mean, it's just a cost thing. It's like, how valuable is the worm data?
Yeah, you wanted to make a graduation more like tenable, right? For more intervention. Makes sense.
Exactly, and I don't think there's a right answer there. You know, so I've been letting each of the different devs decide for themselves. But yeah.
No, I'm definitely grateful for the flexibility we had with planning here, because again, exploring a new intervention, it's like you need to be lucky to hit the right dose. Also, from like if you had only one repetition, yeah.
You can make educated guesses, but with new science, they are guesses.
Yes, exactly.
Yeah, this seems to have like a moderate effect between the two. Super interesting.
Totally.
I'm sure we could find the whole dose response curves if we did, way more experiments. But
yeah, absolutely.
Like, how worth it is that versus pushing in the mice?
Once we get mice data and everyone buys in, we'll be able to make experiments as we want, right?
Amazing.
Many worms will be amped.
Exactly.
Yeah.
The mice shall
Pump
be
the fees, please.
Huh?
Pump the fees.
Pump the fees.
Right, pump the fees. Yeah, pump the fees.
Amazing. So yeah, I guess we gotta await the fly data probably before we publish something, but maybe we can at least start on like the worm section.
Let's start cracking. Yeah.
Cool. All right, let me make a note of that.
Good way to start the year, right?
Yeah.
New paper.
Or the question is, can we have a preprint done by the end of the year? No.
Oh. Yeah.
Absolutely not.
Eventually, yeah, if you decided it didn't matter to you, New Year's Eve, it's like starting now.
Yeah. Anyway, super interesting data, guys. Really excited about this. Yeah, this middle dose seems to be ambiguous result, or not ambiguous, but like right in between.
The
The
sweet
two.
spot is somewhere between. I mean,
Maybe.
probably, maybe.
Maybe.
We don't know. Yeah.
Or maybe
yeah.
it's even a lower dose. You know.
Can also be, although I'm just thinking, a lower dose is. Well, we don't know. I mean, it's complex. But it's like, think, okay, a lower dose is unlikely to help maybe more worms survive longer earlier. Like, in other words, to extend the median lifespan, it's more likely to hit at the. I mean, at least this is how you think about it from, like,
A
linear
mechanistic
model.
perspective.
Yeah, mechanistic and very linear. It doesn't have to be this way. It could be like secondary, tertiary effects. So.
Totally. God, we got to get these into mice, though. We have
For sure. Let's do that. I'm like,
sure.
yeah, I've got some posts to make, and yeah, you also let me know if you've got some ideas on how to like get more people excited about this. Yeah.
You got it, sir. Anyway, well, I guess for you Germans, I just listened to a super interesting podcast. I highly recommend it. This guy, Norman Ohler. I don't know if you're still with us, Christian. I don't know if you've heard of this guy, Norman Ohler. He's like a Berlin-based historian.
Oh. Okay.
And he studied drug use within the Nazis.
Oh.
Okay, that's interesting. Yeah.
It is absolutely fascinating. And basically within the what was the name of the army within the Nazis?
The Wehrmacht.
The Wehrmacht?
Yeah.
Wehrmacht. So they had a division within the Wehrmacht, which was to test performance enhancing drugs.
Oh, interesting.
and this is not well documented, but they had a guy who was like head of performance enhancement, and they had a division where basically like within the concentration camps, they would give either soldiers or prisoners different drugs and just make them walk for days and see which drug could make them walk the farthest or the longest.
Crazy.
And
it's like really
sick, absolutely sick. But they landed on methamphetamine as being like the best short-term performance enhancer.
Yeah.
And so all the Nazis during their conquest of, like basically France were all on meth.
Yeah, that is a known. Yeah, that's like, I think, a wider known fact. So I had heard of this. I hadn't heard of this whole thing of having a division to test this stuff and decide on one.
They had a division. There was like a guy who was in charge of it because when they were deciding how to invade France, they realized that they would have to stay up for 3 days straight. The tanks would, basically.
Okay. Oh, right. So it was about.
So this guy was like, I've got the solution. And so they had Merck start to produce millions of doses of this.
This is crazy, sick. But I mean, that explains, I mean, like, I mean, the way
everyone's like, oh yeah, the Nazis can do blitzkrieg, like they move so fast, but no one explained how. It's like they were superhuman in their drug use.
Crazy, anyway. Man. Yeah, but only for a short while, luckily.
Only for a short while. Anyway, Hitler had his own, basically like physician who was just dosing him with all sorts of opiates and whatnot. And so anyway, I don't feel like a lot of this is like, I didn't know this.
Yeah.
And so I found it to be super interesting. Very mumuch worth a listen.
Funny, I was today just thinking, what podcast did Lex do for the end of the year? Because he usually goes for these deeper ones at the end. And it's this. And this one is recent or not?
It is relatively recent.
Okay.
It's not most recent.
I'm thinking I might have just listened to snippets of this, because the one with the amphetamine story, and so that's like that was familiar to me, but I'm not okay. This is like an older one, not so old. Okay,
I want to listen to the Michael Levin one. I mean, he's a legend in
right?
biology.
Yes, yeah, absolutely.
So,
Electrobiology,
but I don't think he's released an end of year one quite yet.
No, not yet. Okay.
Also, if you guys didn't
Pretty
listen
valid
to the
question.
Pavel Durov one, he's the founder of Telegram.
I listened to this one.
Yeah,
The story
absolutely
with
incredible.
what happened to him in Paris.
Absolutely psychotic.
Yeah, absolutely.
And how they almost killed him. You know, they almost got him.
Oh,
I don't know if you
might
heard
not
that
listen
part.
to all of it then. Yeah.
Listen to the
They're
whole
just
thing.
too
Yeah,
long
there was-
that like usually.
he had an assassination attempt, but he survived.
Oh my,
God.
no, I haven't heard that. Yeah.
Yeah. Anyway. I think
Thanks for the
with that-
recommendation, Benji.
Of course. I thought as a German medicinal chemist, like, you know, you'd find it interesting.
Right, yes.
I will definitely check it out. I have a lot of
You
time
should-
on my, you know, hard drive to.
You should feel, yeah. You should
Benji,
feel like an equal
How did
amount
you manage?
Sorry?
Sorry, go.
No, you go ahead.
Yeah, Benji, how did you manage to listen to Lex Friedman? It's like 4 hours, 3 hours of podcasts.
I do
You're
training.
married, man.
Well, I do training, and you know, basically when you're training, you have to distract yourself for long periods of time. So it goes very well with long form media, honestly. You know, like to sit down and listen to a 4-hour podcast is tough. But if you're doing like a, you know, hour and a half long training session, you know, it makes it easier. But anyway,
So
guys.
I need to train.
Yeah. Highly recommend it. Anyway, guys, thank you so much for joining. Hope you enjoyed. Awesome data being generated. Thank you for A, participating, and B, showing up today. Hope you had fun. Looking forward to the next one. We'll keep pumping. And enjoy the rest of your year, guys. Happy New Year.
Thanks.
Thank you. Happy New Year.
Happy New Year.
Great
Talk soon.
to see you.
Peace.